information that we are sharing today is our own personal experience and does not constitute as medical advice. We do not endorse any products or services. Any said products or services mentioned on this podcast may not be suited for you or your condition. Please consult your physician before making any medical decisions. Today's episode is sponsored by the Wolfen Chair in Digital Health. The Can Do study, a Canada-Netherlands network in precision medicine in childhood arthritis and rheumatic disease, will allow doctors and families to quickly know who needs biologics, which biologics works best for their individual child, and when can the biologic be safely stopped.
Canadian and Dutch physician researchers formed an alliance, Can Do, together with patient and industry representatives and policymakers to develop the first genomics-based, low-cost biomarker blood test to rapidly identify the best treatment for each individual child, completely transforming the care of childhood arthritis. More about how they want to achieve this will be featured in future episodes.
Hello, everybody. Welcome back to Take a Pain Check. Today, we are so excited to introduce this week's guest, Spencer Hamilton. Spencer was actually born in Ottawa, Ontario, and currently resides in Vancouver in British Columbia. He's a pro skateboarder who is known for the refined style and smooth skating. I know nothing about skating, so this makes no sense to me. He hopes to use his voice to help others on their journey. So we're so happy to have you on today. It was a struggle, timing-wise, but I'm glad we got here. How was your trip? Where'd you go?
I was just in Montreal for 2 weeks doing some filming, for some skateboard filming. And then I grew up in Ottawa. My parents, my whole family's still there. So I went there and spent a week or so, about 5 days.
That's nice.
Yeah.
A nice trip.
Yeah.
Can you kind of start off by introducing yourself and your condition?
My name is Spencer Hamilton, and what was it? Maybe 3 years ago, I got diagnosed with ankylosing spondylitis.
What were like the symptoms that happened, or like how it led to you getting that diagnosis?
Well, do you want the long story or the?
We're good for the long story if you want.
Okay. Around 2014, I started noticing just like a random tightness in, I guess where my hamstring kind of meets my buttocks. And being a skateboarder, going through all kinds of aches and pains all the time, I figured, just go to the massage therapist, try to work it out. That wasn't working at all. Chiropractor wasn't working. At the time, I was going on skateboarding trips and not being able to do anything, not really knowing what was going on, and still kind of just thinking like if I could just get rid of this knot, or if someone could just, thinking that it was just like an easy fix, because of the other things that I've had happen. And yeah. It wasn't, honestly, at the beginning, it wasn't maybe as debilitating as it turned out to be, Mm-hmm. At the time, I'm just like, oh, it's just an ache. Like I'm going to get over it.
Yeah.
And so as time went on and nothing was really helping, and I mean, it seemed like kind of just a never ending flare up. It wasn't like, 2 weeks of pain and 2 weeks of being able to do whatever I want. It was kind of initially maybe 6 months of just like progressively getting worse. So then I started to really feel like something obviously was wrong. And as time goes on, it just becomes a more chronic condition. Now I'm into a year of spending all kinds of money on massage and chiropractor and acupuncture and IMS and, going to get CT scans and MRIs and, doing everything I possibly can to figure out what was going on. And again, being a skateboarder, I have a bunch of disc bulges in my lower back. I jump downstairs all the time. It's kind of what I do. So it's pretty easy for a doctor to be like, oh, like you have, at the beginning too, I thought it was nerve pain because I didn't really understand, as time went on, understanding like what nerve pain is, what actual joint pain is, muscular pain, differentiating all those things. At first wasn't so easy. I just assumed it must be nerve pain. You hear about sciatica, and a squished disc must be pushing on a nerve.
Yeah.
So I kind of ran with that for a while because that's what made sense. Doctors were saying that's what made sense. All the radio imaging that I had showed these disc bulges. But eventually, yeah, I got the MRI. That didn't show anything touching a nerve from these disc bulges. So that kind of started to sow a little bit of doubt in me, thinking maybe it could be something else. And that, I guess, would have been maybe over a year after I started feeling symptoms. And throughout that time, again, not a whole lot of good days, some days better than others, but pretty consistently in pain and not really, again, like feeling like a virus is just like taking over my body, you know?
Yeah.
And then, as the year grew into 2 years, like there would be, you know, maybe a few months out of a year that I felt comfortable enough to skateboard and do other stuff. But then always, back to feeling, and obviously dealing with, you know, the mental health issues of all of that, you know, not having any real tools in my toolbox to do anything about it, just having this thing happen to me kind of thing, you know? And also throughout that time, you kind of go through little like waves of being more motivated to seek out different treatments. And then after that goes nowhere, you kind of, you know, you hit a low point and you're like, hey, I can't spend any more money or time on this. It's not working. But my girlfriend arranged just a new physio spot that I hadn't been to, an appointment with a guy. And he was the first one who suggested that I go get a blood test for a genetic marker for something called AS. And that was just after me describing, you know, exactly kind of how I described to you. Again, one thing that really kind of stood out to me throughout the whole time of not thinking that it was a structural issue was the fact that the pain would be so severe in one leg, one side of my body, lower back, hips, throughout the leg. And then like within a day or two, that's my strong leg. My other leg is totally messed up in crazy pain. So, I mean, I don't really know, especially back then, I didn't know a whole lot about the body, but that just didn't make sense to me that one side could feel this messed up. And then within such a short period of time, my strong leg. And I'm like, okay. So describing that to this physiotherapist and him saying, hey, this sounds like something my friend has, ankylosing spondylitis. So from that point, I went to the doctor. I requested a blood test, and that came back positive for HLA-B27. So along with the pain patterns and all of that, I also developed, what's it called? Iritis, which is another kind of a box to check in the diagnostic of ankylosing spondylitis, which is basically just a random inflammation of your eye or your iris. So again, out of nowhere, I woke up one day, I felt like somebody just punched me right in the eye, super sensitive to sunlight, went to the hospital and whatever, dealt with it in a totally isolated manner, you know, didn't think that was connected to my back or anything. But at that time, I did go see a rheumatologist for my eye, and he tested me for rheumatoid arthritis, which I think is HLA-B28. I came back negative for that.
But you came back positive for
HLA-B27.
Yeah. So if he had tested you for both, you might have had your answer earlier. Which
was about a year between seeing him and this physiotherapist, which still kind of gives me a little bit of goosebumps. I actually, I don't know, one of those things where what am I going to do about it? But I felt like yelling at him anyway. It seemed like such an easy thing that he could have tested for. And again, like in hindsight, if you look up the diagnostic tools that they do use for AS, I hit every single marker, you know? So, but that was again, the eye thing kind of really sealed the deal for the next rheumatologists that I saw, you know?
they figured out that like for sure that it was AS.
Yeah, so that after I didn't feel comfortable going back to that same rheumatologist, although I did call and basically complain to him like, you should have been more diligent. But after that, I didn't really feel like there was why would I go back to this guy who made such a glaring mistake,
Yeah.
I went to a different one, and at this time she recommended that I try Celebrex, which I started taking Celebrex probably after my first visit with this second rheumatologist that I was seeing specifically for AS, because my GP felt that with my symptoms plus the genetic marker, it was a good enough reason for her to think that I had AS, so I should go see a rheumatologist for kind of confirmation. So I started seeing this one in Vancouver, and she confirmed it to the best that a rheumatologist can, and suggested the Celebrex. So I went on that for a couple years. Maybe around the first year, it worked all right, and I didn't really want to go to biologics, and that seemed like the end of the road to her, which I just didn't really want to accept. I was holding out that some sort of, whether it was diet or something that I could do to manage it. So I requested to see a different rheumatologist. He was the same, basically. Biologics are the only option, and that's the end of the road, pretty much. And eventually, I did start trying biologics. So now I take a once-a-month injection called Symphony.
Okay.
Mm-hmm.
And I've been taking that for about 10 months now. And I wish I didn't hold out as long as I did. It makes a world of difference.
Yeah.
You've definitely been rheumatologist like hopping or something. There's been a lot that you've seen. You've kind of been like jumping around because they're different one of them. And you've also tried so many different like therapies, I'd say. How did you kind of feel knowing like after that, like none of these actually work? Like I know my mom put me in like random things like homeopathy, naturopathy, acupuncture. You spend so much money because you're so desperate to find something that'll help. Yup. What did I get out of it? Nothing. I'm on drugs. I'm on drugs now. Not using any of that. So how did you kind of feel knowing that you spent so much money on this and nothing worked besides the meds? Your meds are working now, right?
Yeah. Really
so
very effective.
How do you feel? Like you just
again, I learned a lot, right?
Yeah.
Did I need to spend? I can't even imagine how much I spent on therapies that didn't work. Probably like $1,000.
Yeah,
so,
relatable.
Yeah,
relatable.
Did I need to spend $20,000 to learn these things? Probably not. I probably could have learned them
Free.
a little more affordably, but that's how it worked out. And yeah, like I said, I learned some. I learned something about it all.
But I feel like in that moment, you're just so desperate to find something that will work and relieve the pain that you just keep pushing and pushing and hoping that this next one has to have the solution.
Of course. And now, I'm sure you guys feel the same. You're very skeptical. When someone says like, oh, this thing is going to work, it's like, yeah, I've heard that before.
And even like at the rheumatologist, when they tell you, oh yeah, like I remember like my rheumatologist, like the first one I had, every single time we tried a new drug, she'd be like, oh honey, it's gonna work on you, I know it will. I've literally been through like 7 drugs and like none of them worked every single time. And so like I ended up changing rheumatologists. I'm like, bro, like I can't handle you telling me, oh honey, it's gonna work, when it's literally not. It's really frustrating when they tell you that, and I totally understand.
Which I don't know what the point of that would be, like you wishing it works has zero effect on it working. Like, I don't know. Oh, honey, it's going to work. I don't know. It's like you almost want them just to be real with you. Like, I have no idea if it's going to work, but we got to try it. Like,
I feel like I had a little bit of an opposite perspective on it because my methotrexate was working and I'd been on it for quite a while, and my doctor tried to push biologics onto me, and I wasn't like like I wasn't in enough pain for it to warrant me switching medicines.
Mm.
And I was like, my mom kind of like, I was young. I think I was like about 15 when this happened. And my mom kind of had to push back and be like, she's not complaining enough. She's just telling you that sometimes it hurts here and sometimes it hurts here, but it's not enough for her to change medications. So I had a little bit of a pushback differently.
The first thing that I think when I hear that is like, but I wonder how much better you could have felt if you tried biologics.
Hey, I'm just not a needle girl. I never was.
Oh, okay. So that's the barrier for you.
Yeah, I was on methotrexate pills at first, and then I'd already tried prednisone and naproxen and all of those things, and they hadn't worked out properly for me. And once I got on methotrexate, it like really helped. Like it controlled a lot. And then it got to a point where she said I outgrew the pills, but I hadn't. In like from what my rheumatologist says now, this was my previous rheumatologist, and she said I had outgrown the pills, so I went to needles, and I think I was on needles for about 2 years, and then she started pushing biologics onto me, and I said, like, I was getting more pain from the needle phobia than from my actual disease.
No
so I was
way.
like, why would I put myself back in that situation? And I've been on pills. When I switched rheumatologist, I went back on pills. I told her, I'm like, if I can do it, please put me back. And I think I flare up maybe once every couple months, and that's if I overexert my joints. So like I know when I'm gonna flare up because I am overexerting in that point in that moment. So I had a very different experience with that, and like the needle phobia for me was just not worth it. Like I just couldn't. It was horrendous.
I mean, if that's causing you stress and pain and more than the actual illness, then
oh yeah. And my dad used to give me my needles, and my dad's a very like I'm a dad's girl, like that I was always. And he used to cry every week when he had to give them to me. And he would try not to let me see him, and I'd just be like, Dad, like I can see you. Like
oh man. Well, that must have been tough.
yeah, so I don't know.
Whatever works, right? Whatever works and whatever you're comfortable doing, it's like at
oh
least
yeah. Yeah. And I I'm so thankful that it doesn't flare up enough that I have to be on them.
yeah,
I have the choice.
yeah.
So in terms of like your joints, or like I guess like what is affected now and like your symptoms, how has it changed from like maybe 2 years ago to like now? When do you get those like flare-ups, or do you even get them anymore? How does it kind of work now?
Now it's so faint that I question it. Like, and again, I use my body all the time. Like I exert myself kind of, I mean, to my extreme. So I can definitely relate to like the flare-ups associated with overuse of the joints. But yeah, now again, I kind of have to search for it. Like I wouldn't say it's the same as it was pre the onset of the symptoms. I still, at this point, I think it's mostly just like a dull inflammation rather than, so like kind of stiffness, a little more stiffness than usual. Whereas before it was like, it was just a total debilitating pain. Like, so everything hurt, coughing, breathing, stepping off a curb. Like at the worst of it, it was really hard to move around.
In terms of like the fact that you were such an avid skateboarder before and continue to be, how did you kind of have to change your daily habits during that debilitating pain, and how did you continue with those changed habits now?
I mean, I was lucky at the time to have sponsors who stuck with me. I get paid a salary. So throughout that time, again, there would be, a few months out of the year that I could skate, and I would, do my best to get stuff, film as much tricks, shoot as much photos as possible so that I had stuff for the time that I wasn't going to be able to skate. But it was tough. It was obviously just, used to being able to do whatever I want whenever I want, you know? Oh, I'm sore today. Like, okay, whatever. Like, I can still do stuff. Whereas, yeah, in the worst of it, it's like, how long is this going to last? Another day, another week, another 2 months. And again, like that goes into the mental health aspect of it all, of just feeling quite depressed throughout that time. I mean, I leaned on walking. Walking was one thing that I could do. So even though it hurt, it was just, at least you'd go out for a walk, however far it was, just to move.
Just like moving on a little bit, you were, we had to obviously do some research on you, and the article with Arthritis Society, you explained how you tried different methods of therapy. And you also mentioned it on this podcast today.
When it all began, I was smoking cigarettes, and I smoked cigarettes probably for the first couple of years of having symptoms. That was probably one thing that maybe, you know, reduced some. Obviously, they say that's like kind of number one if you're trying to help yourself not feel pain from any kind of autoimmune thing. So quitting that probably had some effect. But honestly, like, of all the massage therapy and needling and chiropractor, like nothing meaningful, you know?
Yeah.
Honestly though, like, relatively low carb diet, and if I really am in a flare up, the only thing that I've ever had that actually reduced pain was actually doing 2 weeks of straight carnivore, eating beef. That's it.
That's so interesting. I've never heard that before. Like, everyone comes on here and says like, okay, like no fish, no more fish, or like take out the dairy. And I've never heard of this. So can you kind of like expand on how that works?
But he's right. Like, red meat does make you inflamed.
Yeah.
I'm eating only red meat.
Only. That's the thing. That's why I'm like, I've never heard of this before.
Yeah, neither have I.
If you feel like it, you can go down quite the rabbit hole on the internet on the carnivore diet. But
hey, whatever works.
Yeah.
Totally. I mean, again, I didn't go on biologics because I didn't really feel like there was a future in me eating nothing but beef. Between traveling and just having some sort of enjoyment for food, that wasn't something that I was looking into long term. But I do like beef. I like steak. And so I gave it a shot. And again, that was something that like the only thing that I did that I have tried that reduced my pain in a noticeable way.
Okay. That's good. Wow. I think honestly, like, everyone deals with their pain in a different way, and like, as long as you found that way, like, good job. I'm glad. I feel like you've been through so much. Like, it's just a bunch of like therapies and.
Well, I mean, kind of so this thing you could do can reduce your pain, but you don't want to do it because it's so annoying. And eating ground beef for breakfast, lunch, and dinner is boring. And
doesn't sound that appetizing to me, but
yeah.
Natasha, your diet sounds better than that.
I know. I'm literally the opposite, so I'm vegan. But do you add seasoning to your beef? Like, is that allowed?
Oh.
Oh, okay.
Yeah.
Interesting.
Yeah.
Okay,
I mean, you add beef tallow, which is beef fat, to ground beef.
Oh my god!
Honestly, within like a few days of eating just steak, it's hard to chew steak 3 meals a day. So you have to go to ground beef just to be able to for your teeth.
Okay, moving on from.
I'm surprised you guys haven't heard of this.
No.
Natasha, did your mom listen? We didn't do a lot of research. The medication worked, so we stuck to the medication.
Fair enough.
I don't know how Natasha's never heard of this.
Yeah, my mom like researches so much, and Like, it's so funny that you mentioned that. Like, I'm vegan because of my arthritis, and like it's helped me a lot. And like you saying, like having ground beef and like beef in general has helped with your like rheumatic disease is so like interesting, because I feel like everyone kind of finds out like how their joints and everything flares, and it's very interesting. I don't know. Anyways, my mom's in research. I don't know. She never told me about this ground beef thing, so I'll definitely
She
maybe
didn't want
ask.
you to eat beef. She didn't want you to
Yeah,
just be eating
no,
beef.
beef was a no. Okay, anyways, so we mentioned like skateboarding throughout this podcast. So when did you learn how to skateboard?
Probably at the age of 6 in Ottawa, something like that.
Wow. I look at the skateboards outside. Like my brother wanted a skateboard, and my parents like, no, too expensive. They went to like the thrift store, bought some random skateboard. Was like, okay, let's try on that. It was literally pink, and it was like kind of gross. Whenever someone's on that, I just feel like they're gonna fall. Like, how do you balance and like make sure you're stable while moving? It probably sounds so dumb, but like, how do you do it?
Well, where do I start? I mean, again, I've been skateboarding since I was 6. So,
Natasha has no athletic ability, okay? None.
okay.
No.
So maybe give a little bit of background of how you did when you were 6 years old. Did you go to like lessons and stuff like that? Are skateboarding lessons a thing?
I'm sure they are for some people.
Okay, so not for you.
No, how I got into it was just neighborhood kids. My brother skateboarded, my older brother skated, and some friends in the neighborhood skated.
Yeah.
So that was just a kind of a pastime. I also played hockey and volleyball and kind of did, all kinds of different things when I was growing up. But skateboarding just something appealed to me.
Something completely opposite from Natasha,
Yep.
Didn't do the sports thing. But I was going to ask, you mentioned that you were on a salary during all of the diagnosis process. So how did your arthritis actually impact your skating career?
Well, I didn't have a whole lot going on for those the main couple of years until Celebrex definitely lifted a lot of it, which my timeline is a little fuzzy on all of it. But there was at least 2 or 3 years of not doing much. And again, lucky to have the sponsors that I had who stuck with me and continued to pay me despite the fact that I couldn't do much. But yeah, I would have much rather not had to go through all of this and have, whatever projects I would have worked on in that time. But is what it is. Could have been worse too.
How did it impact, how does it now impact your warm-ups and your workouts?
Since I've been on biologics, I feel so much more consistent with my days. I can plan my days. I can plan my week. I'll go on this trip, okay, we're going to somewhere in the States or somewhere to Europe. Like, hopefully I can skate. I'm down to come. We'll see what happens. Now I'm kind of like, oh, okay. Like, I can plan these. I'm confident that I'll be able to skate. But before, it was like, while I was on Celebrex, I'd still have flare-ups that were debilitating, so I couldn't skate. But throughout that, there were days where, I'm eating the maximum amount of Tylenol that I can, plus the Celebrex, plus eating, basically steak twice a day with eggs and some salad on the side. That's about it. So doing everything I can and still being in a whole lot of pain, but fighting through it. Because again, once I found out, like, okay, this is just like my body creating this inflammation in these joints, I started to fear the pain less. At the beginning, I was like, something's gonna break in here. Like, chiropractor, I'm like, well, don't pull too hard. Like, I don't know, like,
I don't know if you're pulling at the right thing.
Yeah, I have no idea. And I'm thinking, like, again, like this nerve thing was in my head. And like, yeah, are you going to pull on something and something's going to break or snap? So once I found out it's an autoimmune thing, I started to, like, I don't know, looking back at some of the tricks that I did film while in a whole lot of pain are kind of surprising.
Yeah.
just dealing with the pain and yeah, trying my best to ignore it.
Did you ever think you would never be able to skateboard again due to your arthritis during any point of your skateboarding career?
As soon as I was diagnosed and on Celebrex, I felt a whole lot more confident. But pre-diagnosis, yeah, I was like, is this it? Am I like, is this what I have in store for the rest of my life? Like,
Yeah.
just nothing that I'm doing is helping. And yeah, the frustrations obviously too with like, I'm going to a doctor and she's not really providing me with any meaningful options. And everyone kind of looks at you like, you know, the classic lower back disc bulges, like go home and do sit-ups, go do some yoga. And you're just like, I mean, I have a strong core. I do yoga. I don't know what you're talking, like, not that ain't helping. Like, you know.
How did you tell your coaches and teammates about it?
We don't have coaches necessarily in skating. It's,
Okay.
you have a team manager who's generally a skateboarder as well, just, you know, at a different point in his career. And then the team, it's one of those things that you explain so many times to people that it's like, I'm halfway between like, this guy must know, and he probably has no idea still. You know? So I have no idea what they think or how they feel about what goes on with me. Everybody can understand injuries, but I mean, nowadays people have a family member or something, a friend who has an autoimmune condition, so they're a little more like aware that these things exist and how they manifest themselves.
Yeah.
But if you don't know anybody with that, then you're kind of like, it could sound magical, you know? You have these flare-ups of this thing that makes it impossible for you to skate, like, you know, and that goes into your head, you know. If I'm on a trip and I can't skate, I'm like, man, I hope these people don't think that I'm just making this up and I don't want to skate, because some crazy people will go on a trip and be like, I stubbed my toe, I can't skate for the next 2 weeks. And it's like, you know, okay, the last thing I want is for people to think of me like that. You know, I'm one of those guys who really does try to give it his all the time.
Yeah.
And so the balance of like, you know, hopefully they don't think like that, but I also don't want to just like talk to them till I'm blue in the face about my problems. Like every day, like, man, like I'm going through so much pain. The last thing I want to do is like bring people down on a trip either, you know?
Yeah.
You try to just support everybody the best you can if you can't skate.
Yeah. I feel like that's a very, it's a very person with an autoimmune disease that doesn't look like they have an autoimmune disease kind of thing. Cause I feel like I'm like that too, is like, you don't want people to think that, you're not doing it for no reason, but it's like, I'm not doing it because I genuinely can't do it, even though you can't see that.
Exactly.
Yeah.
And tomorrow I might be able to do it. I have no idea, you know? Which, again, trying to describe that or explain that sometimes just feels,
Yeah.
Thank you so much for coming on to our podcast today. We really had a great conversation and talked about many things like skateboarding, something that I don't do. But, you know, I saw your tricks and flips and all that. And yeah, thank you for coming again. Everyone check out Spencer's social media accounts and what he's doing. And like, comment, subscribe, all that fun stuff. And yeah, we'll see everyone next week on Take a Pain Check. Bye.
Thanks for having me.